Lisinopril is one of the most common medications worldwide. Millions of people take it every day, mostly for blood pressure or heart problems. But most of them don't really know what it's doing inside their body. They just know it keeps a number on a screen in a safe range. That's worth changing. Because when you actually understand how this drug works, you're much better at using it safely, and you're more likely to catch a problem before it gets serious. So let's walk through what lisinopril actually does, and 8 side effects that either get missed, get blamed on something else, or just don't get talked about enough. Lisinopril belongs to a group of drugs called ACE inhibitors. ACE stands for angiotensin converting enzyme. That sounds complicated, but the idea is simple. Your body uses a chain of chemical signals to control blood pressure. One of the key chemicals in that chain causes your blood vessels to tighten up, and when they tighten, pressure goes up. Lisinopril blocks the step that makes that chemical. So your vessels relax. Pressure comes down. It also takes some of the load off your heart. That's why doctors use it not just for high blood pressure, but for heart failure, certain kidney problems in diabetics, and after a heart attack. There's decades of solid research behind it. It's a genuinely useful drug. But when you block a major chemical pathway in the body, other things shift. That's where the side effects come in. The first one is something almost everyone has heard of, but a surprising number of people never connect to their medication. A dry, nagging, persistent cough. It happens in somewhere between 10 and 20% of people on ACE inhibitors, possibly more. Here's why it happens. When lisinopril blocks that enzyme, a substance called bradykinin builds up in the body. Bradykinin irritates the airways. The result is a dry, tickling cough that just won't go away, and it has nothing to do with being sick. No infection, no cold, just the drug. Many people spend months trying cough medicine, allergy pills, or even asthma inhalers before someone makes the connection. If you started a new cough after starting lisinopril and it hasn't gone away, that's almost certainly why. There are other medications, called ARBs, that work in a very similar way but don't cause this. Your doctor can make that switch. The second effect is more serious. It's called angioedema. This is a sudden swelling, usually in the lips, tongue, face, or throat. It comes from the same bradykinin buildup. It doesn't happen often, roughly 1 in 100 people, but when it does, it can be dangerous. Swelling in the throat can block your airway. And here's the part that catches people off guard. It can happen even after you've been on the medication for months or years without any issues. If you ever notice sudden swelling in your face or throat while on lisinopril, that's an emergency. Get help. Don't wait to see if it goes down. The third effect is low blood pressure, and it's more common than people expect, especially in the early days of treatment. The medication is doing exactly what it's supposed to do. But sometimes it works a little too well, and pressure drops more than intended. You might feel dizzy when you stand up fast. Some people feel lightheaded in the morning or after being active. This usually settles down as your body adjusts. But it's a real fall risk, especially for older adults. Standing up slowly and drinking enough water during the day can help a lot. The fourth effect has to do with potassium, and this one is important. Lisinopril reduces a hormone in the body that tells your kidneys to get rid of potassium. Less of that hormone means your body holds on to more potassium than usual. For most people, it stays in a normal range, but if you're eating a lot of high potassium foods, bananas, potatoes, spinach, avocado, or if you're taking other medications that also raise potassium, the level can climb too high. Too much potassium in the blood throws off the electrical signals in your heart. It can cause an irregular heartbeat, muscle weakness, or in serious cases, cardiac arrest. This is exactly why your doctor orders blood work while you are on lisinopril. Don't skip those labs. The fifth effect involves the kidneys, and this one surprises a lot of people. Lisinopril is actually used to protect the kidneys in people with diabetes or chronic kidney disease, and it does that job well. But in certain situations, it can reduce blood flow to the kidneys in a way that temporarily hurts kidney function. This is especially true in people who have a narrowing in the arteries that supply the kidneys. It can also become a problem if you're taking ibuprofen or naproxen regularly. Those pain relievers interfere with how the kidneys handle blood flow. A small rise in kidney numbers when you first start lisinopril is normal and expected. A big jump should be looked at. The sixth effect is fatigue and weakness. Not everyone gets this, but it does happen. When blood pressure drops to a lower level than your body is used to, it can take time to adjust. You might feel more tired than usual, or feel like your energy just isn't there. If this started after beginning the medication and nothing else explains it, it's worth mentioning at your next appointment. The seventh effect is a skin rash. A small number of people develop a rash, usually mild, sometimes itchy, often on the chest, back, or arms. It tends to show up within the first few weeks. Sometimes it fades on its own. Sometimes it's a sign that your body is reacting to the medication and a change needs to be made. Either way, if you notice a new rash after starting Lisinopril, show your doctor. Don't just ignore it and hope it goes away. The eighth effect is a change in taste. Some people notice that food tastes metallic, dull, or just off. It's more common than you might expect from reading the drug label. It may have something to do with how ACE inhibitors affect zinc levels in the body. For most people, it gets better over time. But if your appetite has dropped or nothing tastes right since starting this medication, that could be why. Now, let's be clear about something. Most people who take Lisinopril do fine with it. The majority won't experience all of these side effects, or even most of them. This medication genuinely saves lives. It lowers the risk of stroke and heart attack, slows kidney damage in diabetics, and protects the heart over the long term. The point of going through all of this isn't to scare you. It's to make sure you're not caught off guard. In practical terms, here's what matters. Get your blood tests done when your doctor orders them. At minimum, your kidney numbers and your potassium. If you develop a cough that won't quit, don't just live with it. There are other options. If you feel dizzy when you stand up, give it time, drink more water, and move more slowly. And if you ever have sudden swelling of your face or throat, that is an emergency. Also worth knowing, Lisinopril interacts with some common things. Ibuprofen and naproxen can reduce how well the drug works and make kidney side effects more likely. Potassium supplements or salt substitutes that contain potassium can push your potassium too high. Alcohol makes the blood pressure drop more pronounced and increases dizziness. And if you get dehydrated, from being sick, being outside in heat, or just not drinking enough, the drop in blood pressure can hit harder than usual. None of this means the medication is dangerous. It means it works in a real way, inside a complex system, and a little awareness goes a long way. Lisinopril has been used since the 1980s. Doctors know it well. When it's matched to the right person, monitored properly, and used with some basic awareness, it performs exactly as intended. What makes the difference is not being passive about it. Pay attention to how your body feels. Keep up with your lab work. And if something changes after starting or adjusting this medication, ask. That conversation is always worth having. And there you have it. Take this knowledge and take control of your health. Thank you for watching.